Good evening, everyone. My name is Whitney Cipolla, and I am the Advocacy Specialist with Mental Health Association Oklahoma and a member of the Cover OK Coalition. On behalf of Oklahoma Policy Institute and the Cover OK Coalition, thank you for joining us tonight. We have an exciting lineup of speakers that will help walk us through the ins and outs of enrolling for Medicaid expansion, whether it's for yourself, to help a client, or to assist a fellow community member. Medicaid expansion is a great opportunity to connect Oklahomans with much needed health care. This can be a complicated process, so please feel free to submit questions in the chat as we move through the presentation. We will try to answer as many questions as time allows in our curated Q&A after hearing from all of our speakers. Without further ado, I'd like to introduce you to our experts this evening. Our first presenter is Steve Goldman. He is a health navigator with the nonprofit insurance enrollment program at Legal Aid Services of Oklahoma. He helps people with the Health Insurance Marketplace and healthcare.gov website for people who are self-employed, independent contractors, or don't have a health plan from their employer. For Oklahoma's Medicaid expansion, he creates educational materials for patients and trains people to help enroll more Oklahomans in Soonercare. Next, we have Cassidy Heit. She is the Director of Communications and Strategic Initiatives at Oklahoma Primary Care Association. OKPCA is a statewide membership of community health centers, nonprofit healthcare providers that provide comprehensive medical, behavioral health, substance use, vision, and dental care to patients throughout the state. Community health centers provide medical homes for Oklahomans regardless of insurance type or income. We will then be joined by Cindy Alexander with Indivisible Stillwater for our advocates out in the audience. I'd like to thank our speakers for being here tonight, and take it away, Steve.
Thanks so very much, and welcome to everybody. The goal is to get everybody fully informed so that you can talk to friends and neighbors and other groups about Medicaid expansion. The way to start here is to show that for most folks get their health insurance from their job. But now here in Oklahoma, there are lots of folks who are self-employed or independent contractors, a lot of folks who work part-time or work for companies that are too small, don't offer health insurance. So there's been two routes for folks to get insurance. And we'll take a look at the first slide here, that if we start on the right, there's the Aca Marketplace, or the healthcare.gov. And about 180,000 Oklahomans now get their health insurance through the marketplace. It's for people whose incomes is above Medicaid range and don't have any coverage offer from their job or spouse's job. Here in Oklahoma, the marketplace is quite big. There's 6 different insurance companies, up to 50 different plans that people choose from. Of course, pre-existing conditions are covered. That's what the ACA was all about. And there are discounts based on income in the marketplace, so that here in Oklahoma, incomes up to $40,000 for one person have the choice of plans with a 0 monthly premium. So a lot of folks have been signing up in the past few months. Please tell friends that Marketplace is open until August 15th for Oklahomans to sign up, and then reopens November 1st to December 15th. To sign up for 2022. Moving to the left side, our main topic tonight is about Medicaid and Medicaid expansion. Oklahoma has joined 36 other states in what's called expanding Medicaid to adults, basically adults who don't have children or do have children. And the income limit is 138% FPL, which is jargon for about 1.3 times poverty level. So just a little over official poverty level, as well as the traditional Medicaid adult population of the aged and blind and disabled. So what's new for Oklahoma is coverage for adults with or without kids. With Medicaid, or Soonercare as we call it here, pre-existing conditions are covered, and you can enroll any day and coverage starts that day for adults after July 1st. So as we tell folks with Soonercare, pre-existing conditions are included, but pre-existing bills are not. So one of the key messages to folks is please sign up now before you need it. If we go on ahead and take a look at some of the common questions about, for example, is it worth signing up for Medicaid? What does it cover? Soonercare covers both medical and behavioral health, plus some limited adult dental. Soonercare, importantly for our state, covers behavioral health and substance abuse treatment. It covers pregnancy and maternity and contraceptive and family planning. It includes in-hospital and outpatient procedures. All the immunizations are included. Labs, x-rays, mammograms are covered as well. Folks can see the entire member handbook on the Soonercare website and see exactly what's covered. Soonercare also has an after hours list where the providers that are available after 5 o'clock are listed. And again, list of what's covered at the official website that the state has called mysoonercare.org. Again, mysoonercare.org. Like with any insurance plan, whether it's from the job or you get it yourself on the marketplace, Soonercare has a list of in-network doctors and hospitals and other providers that you go by. Another change coming up for our Oklahoma Medicaid or Soonercare is that some enrollees will choose a managed care organization. You may be hearing all about MCOs, and that's something that most enrollees in Soonercare will have then their choice of a managed care organization, a particular insurance company. And that may provide access to more services and may change the list of doctors or hospitals that someone on Soonercare uses. Going on ahead, folks ask, well, how do I apply for Medicaid? Most everybody just does it online at the official site, mysoonercare.org. Or you can call the 800 number for Soonercare and they will type everything in for you as well as answering questions. So you see the website and phone number there. Most people qualify for Soonercare based on their income for their household size. We'll look at the different income levels for different size households. And there are 2 different income levels. And children under 19 and pregnant women are eligible and stay eligible for Soonercare at a higher income level than the adults that come into Medicaid expansion. There's also separate enrollment for folks who are 65 and above, blind, disabled, or on Medicare. And that goes through the Oklahoma Department of Human Services. And the website for them is at okdhslive.org. Let's take a look at the income levels, because 1 out of 4 Oklahomans is on Soonercare right now. That's just the state of our state, that 1 out of 4 Oklahomans, or just about 1 million Oklahomans, are on Soonercare currently, and more people are becoming eligible. This income chart shows the maximum level, that 138% FPL, or a little over poverty level, where somebody becomes eligible for Soonercare at monthly incomes below basically $1,500 for a single person, $2,000 for a 2-person household, $2,500 for 3, $3,000 for a 4-person household. But don't try to memorize these or write them down. Let me have you write down the website, where there's a wonderful handout in both Spanish and English with all these numbers and more information about doing the Soonercare application. And that website is there at the bottom of your screen, okpolicy.org/countdown. And that provides a lot of information for you and for your friends and neighbors as well. The next slide asks that question about when can I apply for Medicaid adult expansion? And the time's coming right up, which is applications open June 1st for coverage starting July 1st. So people can apply during June and have their coverage start right the first day on July 1st. Or they can apply July 1st or any day afterwards, and coverage starts the same day. That's a key thing for Medicaid or Soonercare. Coverage starts the day that you apply, but again, you have to apply before you incur bills if you want those bills covered. The Oklahoma Healthcare Authority, which is the state agency that runs Soonercare, will be reprocessing some of the applications for people who now qualify for full Medicaid or Soonercare. And those are the people who are on the plans that had more limited coverage. Sooner Plan, Insure Oklahoma, other types of applications submitted since April 1st. Those folks will be automatically transferred into full Medicaid or Soonercare. But really, most people will need to do a Soonercare application or update their Soonercare application. There are many parents, adults, who have children on Soonercare right now. The kids have Soonercare, but the parents don't. And that's not an automatic transfer. So if you know parents whose kids are on Soonercare, you can suggest that the parents go in and just rerun their application. All the information's in there. It just needs to be rerun, and it will look for the adults now to have Soonercare as well. Going on from when I can apply, the next section gives you some of the more details that a Soonercare application asks for income information for this month only. A Soonercare application looks at right now who's in the household, so they can count the number of people in the household and see then what the income level is for Soonercare eligibility. People whose income is zero or are unemployed, that's okay. People who are on unemployment, that's okay also. And the unemployment income does not include the extra $300 that some folks have been getting. And that extra $300 goes away at the end of June, but it's not counted for the Soonercare income limits anyway. There are no work requirements. As we talk to folks, that's one of the questions that comes up because people are remembering a couple of years ago, work requirements was a big buzzword for Medicaid. But in Oklahoma, there are no work requirements. And there's no tax filing needed, either in the past or in the future. And for people who are self-employed or independent contractors, their income is net after business deductions. So we know a lot of folks who are self-employed, and for Soonercare applications, the income that goes in is their net income. So happy to have other questions about Soonercare itself, and especially about the application process. Because as I mentioned, 1 out of 4 Oklahomans is on Soonercare right now. So you can tell folks that doing the application online, calling the 800 number is about what 1 million Oklahomans have done. And folks can do it for themselves as well, or we're happy to help. So look forward to everyone's questions and getting more folks the health care that they need. Thanks so very much. Let me ask Cassidy Heit to join us.
Great. Thank you so much. Thanks for having me, and also special thanks to Steve. I've had the pleasure of working with him over the past 2 years, and you can find a kinder or more knowledgeable source on Medicaid or Marketplace enrollment. So thank you again. So I'm going to talk for a bit about the impact or the potential impact of Medicaid expansion on community health centers and their patients. So if you aren't familiar with community health centers or CHCs or federally qualified health centers or FQHCs or sometimes just health centers, you're not the only one. So together they constitute a primary care network that serves over 275,000 Oklahomans and 30 million Americans. At the Oklahoma Primary Care Association, we're proud to have as members all 22 community health centers that serve Oklahomans across over 120 sites. I've got a map up right now that I don't expect you to be able to read, but you can go to our website, okpca.org, if you want to learn more about community health centers that are near you and what services they provide. Next, please. Thank you. So across the state, about 1 in 7 Oklahomans lacks health insurance, but at community health centers, that's closer to 1 in 3. So about 1 in 3 Oklahoma community health center patients has no healthcare coverage at all. And that's because both by design and by mission, community health centers serve high need areas where there are fewer access to healthcare professionals and higher uninsured rates and poorer healthcare outcomes. That's not to say that you can only see a community health center if you are uninsured or underinsured. They're high quality primary care homes for everyone who walks in the door, but they deliberately serve those areas that have high need. And because of that, 1 in 10 Medicaid recipients in Oklahoma is already served by a health center, and 1 in 8 uninsured Oklahomans is served by a community health center. So like you saw on the map ahead, there are 22 different community health centers that serve patients in Oklahoma. And each one of them is a separate nonprofit organization, but they do have some things in common. So health centers are all required to see all patients regardless of ability to pay or insurance type. And they all offer sliding fee scales for patients with household incomes between 100 and 200% of the federal poverty level. It means if you come in with an income in that range, your payment will be discounted. And if you have an income below 100% of the federal poverty level, you'll pay a nominal fee. It could be 0 or a little bit more than that, depending on what's set by the patient majority board of that health center. That's another thing that's unique about health centers. So they, at least 51% of their board members are members that are served by that health center or patients at that health center, and they work together to determine the services that health center provides based on the needs of that local community. And so because health centers offer that sliding fee scale and collect that income information, we know that right now, over 93% of patients whose incomes we know live in households that earn less than 200% of the federal poverty level. And 72% of those patients make less than 100% of the federal poverty level. So we know that as the state looks to expand Medicaid to adults with incomes below 138% of the poverty level, that a lot of community health center patients who are currently uninsured, who don't have a payer source, will have one. Can we go to the next slide, please? Thank you. Okay, so another way that we know that health center patients are likely to expect gains in coverage is because that's been the experience in other states. So studies have shown, and these charts from Kaiser Family Foundation show, that in the years immediately following expansion, health centers in the states that opted to expand Medicaid saw large shifts in their patient populations from being largely uninsured to having Medicaid as the primary insurance type. And we also saw that health centers in expansion states saw shifts in their payer mix from being reliant a little bit more heavily on their federal grants to relying on Medicaid as the largest source of revenue. And that means that as Medicaid expands, it doesn't just help the patients, although it certainly does. It helps provide health centers and a lot of other provider types with much needed revenue to hire additional providers and to serve patients across the state and across payer types too. Next slide, please. So this is kind of what I was just talking about. Patients who are existing patients of community health centers will expect to see not just they may be getting their primary care needs met, but now they can get their specialty care. They can go and get low-cost prescriptions in hospitals, et cetera. And so because patients have coverage along the continuum of care, studies have shown that their health outcomes improve as well. And the health outcomes, as they improve, also allow community health centers and other provider types to reinvest in their services. And so community health centers and rural hospitals, other provider types, have seen declines in their uncompensated care, and which has led to better financial sustainability, which in turn sometimes leads to reductions in private premiums as well. Next slide. Thank you. So like I said, community health centers are all different and they all vary in the services they offer. Behavioral health, substance use treatment and recovery, vision, dental, primary care, etc. And if you go to our website at okpca.org or okpca.org/community-health-centers, you'll see a list of health centers and their addresses, phone numbers, websites, and you can get connected to a health center that's in your area. One of the things about health centers that's really unique is that they are so concerned with treating the whole person and providing wraparound services that really get past all of the things that keep us from getting healthy. So health centers often provide things like care coordination, transportation and food assistance, translation, and enrollment assistance. So if you're in need of help and you are either an existing or potential community health center patient, I'd encourage you to get in touch with a community health center to learn more about benefits that you may qualify. It could include Medicaid or Marketplace coverage. It could also include other things I have up on the screen, like SNAP or food assistance, or the FCC's new electronic broadband benefit program. So health centers are a resource to you, and I'd like to be one as well. So my email is there. You can contact me with any questions about health centers throughout the state. If there's anything I can help with, I'm happy to. So that's it for me, and I'll turn it over to Cindy.
We worked hard to bring Medicaid expansion to Oklahoma. Now let's work hard to be sure our fellow Oklahomans get enrolled. Newly eligible individuals may be unaware of the changes that affect them or unsure if they qualify for the new program. We hope to see the Oklahoma Healthcare Authority use targeted advertising, direct mail, broadcast emails, and other methods to alert Oklahomans to the changes in Soonercare eligibility. We can expand their outreach and increase their awareness. You've been provided links previously, but they're all collected for you on the next slide. And we'll give you resources you can use to spread the word about Medicaid expansion, to enroll yourself, or to help someone else enroll. As individuals, we can talk to our family and friends, share social media posts, share information via email, write letters to the editor, a highly underused method of communication, contact our local media outlets, and post flyers. Take the necessary actions to have Medicaid expansion enrollment discussed in all your groups, all the civic organizations in which you participate, and in your religious gatherings. Plan tabling events to provide enrollment information. Ask to have enrollment information included in the newsletters that you get from your groups and organizations. Have flyers printed and available at your meetings. And contact local food banks and ask to have the flyers available or volunteer to stuff them into the food boxes. Next slide, please. Thanks. Here are a list of those resources all at one place. You can see at the top the link where you would actually go to apply for Soonercare. There are then a number of phone numbers and an email address where you can get assistance if you need it. And at the okpolicy.org/countdown, you will find a printable flyer. It's both in English and in Spanish. It's in color, but I personally printed it on my black and white printer because that's what I have at home. So do what I did. Print 10 or so and put them in your car along with the stapler or some thumbtacks. And anytime you go in someplace where they'll allow you to, put the flyer up. The very last link is a resource from the state of Oklahoma that has probably 8 or 10 additional links on it, provides all sorts of excellent information. And if you're helping somebody else or you want to direct them to that resource, chances are your question can be answered there. If not, don't hesitate to pick up the phone, or you can email the Steve Goldman, who's been kind enough to serve as a navigator and is an expert in the area. I know he'll help you promptly. So that's those are my ideas for how we can help spread the word. And I'm going to send it back to Whitney and we can start doing a question and answer period.
Thanks so much, Cindy. So you guys have been sending in questions. Please continue to do so if you have questions, and we'll direct them appropriately. You'll also see the question at the bottom of your screen. All right, the first question, what are the issues concerning college students? I think we're going to Steve for this first one.
Thanks very much, Mike. College students are a good example of how Soonercare looks at two things. It looks at what's the household and what's the income. So for a college student can be their own household. If they're not on their parents' tax return anymore, then a college student is their very own household of one or whatever it might be. And their income is what makes them qualified for Soonercare. So a college student with zero income or just working part-time, who's single, income's under about $1,400 a month, they would be eligible for Soonercare. A college student who's still on their parents' tax return as a dependent, then that has to do with the entire family's household. So that can be one of the things that families weigh, is having the health coverage with Medicaid versus whatever tax breaks they may get for having one more child on their tax return. And most recently, the major tax benefits of having one more child phase out after age 17. So it's a matter, again, that Soonercare looks at what's the person's household and what's income for that household.
Thanks for that answer. Our next question we have is from Thelda, and it says, I have Medicare and community care, but it does not cover dental, and the copay for some things are very high. Would I qualify for Medicaid? Well, unfortunately, we can't determine individual eligibility, but we would recommend that you apply through DHS and see if you apply for any additional assistance. If you have a pen or need to refer back to this presentation later, you can contact DHS at their hotline number, which is 1-877-751-2972. Next question comes from Ian. Are there any live sign-up events scheduled before July 1st? Let's go to Steve or Cassidy.
Hi, Ian. Yeah, so if you're looking for in-person enrollment assistance, I would encourage you to contact a community health center in your area, and I'd be happy to help you find one. But there are also a lot of other community providers that will be helping folks assist with Medicaid. I'm sorry that I can't name a mass event on hand, but if you let us know, we'll get you connected to something. You can also turn to individuals and family members to help with enrollment. Like Steve said, 1 million Oklahomans are enrolled in Medicaid right now, and the process online is relatively simple, but we know it can get complicated. So reach out with a little specific information, and we'll connect you.
Thanks, Cassidy. Our next question is for Steve. What materials do people need to have in order to apply?
Care application looks to qualify people for Soonercare based on how big is the household and how much income for the entire household. So that's primarily what the questions are. A Soonercare application asks for who's in your household, their names, their social security numbers, their birth dates in order to calculate age. And then it asks about income for everyone in the household, whoever you think of as in your household. And income can be zero, Income can be from a job. Income can be from Social Security, retirement, or disability. And then the application looks at that chart for number of people in the household, amount of income. Are you within the Soonercare income guidelines or below it? And so that's basically what a Soonercare application does. OK Policy is working on a step-by-step do-it-yourself guide for that. So please stay tuned for that helpful handout as well.
Our next question asks, or really states, applying for Medicare or Medicaid can be difficult for those whose language is not English. Cassidy, do you have any resources for folks who speak languages other than English?
Hi. So I would again, encourage you to reach out to a community health center. Most offer some kind of translation assistance services. I believe Korean was the one in the chat. Again, you can follow up with me personally at cheit@okpca.org, and I'd love to help you get connected. If not, okpolicy.org/countdown may have other potential resources for you on that topic.
Now, a common question I see, people aren't entirely sure, there are a lot of numbers up there. They're not sure, they have a unique situation. They don't know if they will qualify. Steve, should these people who aren't certain they will qualify apply anyway?
Oh, always, because a Soonercare application you can do and then redo and then do again as your circumstances change as well. So go ahead and do the application, depending on how quickly you can type names and Social Security numbers and ages and incomes. It generally doesn't take more than 15 minutes, and you'll get an immediate answer. And you can take a look at that answer and say, something's not right, and redo the application. So it's all in your hands.
Our next question says, for individuals with zero income who now qualify for Medicaid, will their prescription copays or office visit copays be waived, or are there ways to help them with this? This one, let's go to Steve.
That's unclear at the moment. The maximum copay is $4. And it's just unclear at this point how they're going to handle zero income people. So again, please do the application, because the key thing is to have coverage before you incur a bill. And keep in touch, and we'll get answers for folks. Folks can also call the Soonercare line and say, I filled out an application and I need help with it, or get their questions answered as well.
Let's see if we have any last minute questions coming in. I know we are getting close. Okay, next question. What happens between July 1st and October 1st? We'll go to our resident expert, Steve.
Starting June 1st with applications is Medicaid expansion to the wider adult population, adults without kids or adults with kids who just weren't eligible for Soonercare before. And applications start June 1st, and then coverage starts July 1st. The next phase for all of Soonercare, not just the adult expansion, not just for new folks, but for nearly all people on Soonercare, kids and adults, except for that aged, blind, disabled, and some other special groups. Everyone on Soonercare will be transferred to what's called a managed care organization. People will make their choice from 4 different medical insurance companies and 3 different dental insurance companies. And starting October 1st, those medical managed care and dental managed care organizations will then be taking over the care of Oklahomans on Soonercare. So it's a time for folks to get their applications in when they're newly eligible, and for everyone who is on Soonercare right now to make sure that Soonercare has your current address and your current email address, because you'll be getting lots of information about your choices in August and September to choose your own managed care organizations for Soonercare going forward after October 1st.
Thanks, Steve. And I will say one point of clarification, American Indians will have the choice, so they won't be mandated to move into managed care. That section of the population is just slightly different. I know several people have asked for Cassidy's email. You can find her email in the chat. Steve and her contact info will also be in the PowerPoint presentation that you can have access to, as well as the slides, if you visit okpolicy.org/countdown or coverok.org for more information and those resources to refer back to. I want to thank you all so much for joining us tonight on this really important topic for how to get Oklahomans access to health care. Have a wonderful evening, and don't forget, enrollment for Medicaid expansion adults, that starts June 1st.